Welcome to the Maternity Mentor. Today we will be talking about what labor contractions really feel like so you know if the big day is today. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. With your due date rapidly approaching, there is only one thing on your mind. What are the contractions going to feel like, and how am I going to know that I am really in labor? Let's explore what contractions and labor feels like so you know if it's really time to have your baby. Braxton Hicks contractions are practice contractions, also called false contractions. They can start very early in the pregnancy, but are usually not felt or noticed by mom until her third trimester. These contractions come at random times, but they do not dilate your cervix. They help prepare your uterus and your body for the birth of your baby. In addition to randomly happening, Braxton Hicks contractions may also be caused by sex, a full bladder, and dehydration. Braxton Hicks contractions do not pose any risk for complications or preterm labor. These contractions are less intense than regular labor contractions, but may be mistaken for real labor, especially in a first-time mom. Braxton Hicks contractions may feel like a tightening sensation in the stomach that sometimes causes discomfort and sometimes doesn't. The contractions can also feel like cramping in the stomach or back, similar to period cramps. These contractions come and go, never really developing a pattern or rhythm. Braxton Hicks contractions can be stopped or slowed through a variety of methods, including massage, rest, drinking fluids, taking a shower, and movement. Finally, and most importantly, Braxton Hicks contractions do not get more intense or stronger over time, which is expected in labor contractions. If your Braxton Hicks contractions are very painful, or if you are concerned, contact your healthcare provider so they can rule out true labor and provide you with guidance. For more information on sex during pregnancy, please see our video on this. We will link that in the description below. Labor contractions are designed to help dilate and efface your cervix or open your cervix up and thin it out so you can deliver your baby. Contractions do this via tightening or contracting your uterus, which helps naturally open the cervix. Labor contractions may feel like period cramps, pelvic pressure, mild, moderate, or severe backache that comes and goes, an urge to use the bathroom that comes and goes, or a rock-hard, tight stomach that comes and goes. Labor contractions may radiate from the back of your core to the front of your core, or vice versa. Another important feature of labor contractions is their regular pattern and length. Many women describe contractions as a wave of pain. It starts low, building in intensity as the contraction becomes stronger, with a peak and then a gradual decline to baseline. Many women will choose to view the pain in other terms, like waves in the ocean or a flower blooming and closing, as this is a means of mindful distraction to assist with it. It can be very hard to tell the difference between true labor contractions versus Braxton Hicks contractions. Labor contractions become stronger, more frequent, and more regular over time. Braxton Hicks contractions usually go away or become less intense with changes in position. Labor contractions will actually get stronger with activity. True labor may cause your water to break, also known as rupture of membranes. However, this only happens in about 15% of women. Many women will experience what is known as the bloody show. This is a brownish, pinkish, or a red bloody discharge seen when using the bathroom. The bloody show does not occur with Braxton Hicks contractions. Finally, true labor contractions may cause stomach upset, diarrhea, and cramping. This will not occur with Braxton Hicks contractions. If you believe true labor has begun, it's important to contact your healthcare provider. They will let you know when to head to the birthing center or hospital if that's where you're going to have your baby. Now, if you're planning a home birth, they will want to know how you feel and give you guidance on what to expect. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about how stage 1 early phase labor contractions feel. There are 3 different phases to the first stage of labor: early, active, and the transition phase. Then the second stage or pushing stage of labor begins. Prodromal labor is pre-stage contractions that can happen before stage 1 early phase labor. It's the most difficult stage to identify, and it feels a little different for every woman. This process can be slow, taking place over days or sometimes weeks. These contractions are short in length, sometimes painful, and not as intense as stage 1 labor contractions. Prodromal labor is different from Braxton Hicks because it is more regular in nature. It will often look like a woman who is, for example, close to her due date, and every night for 2 hours she has contractions that last for 1 minute and are 10 minutes apart. These contractions do not get closer together, they do not get stronger, and they stop on their own. This is prodromal labor. Then stage 1 early phase labor contractions will begin. This phase produces the cervical dilation up to 6 centimeters and usually happens over several hours. Early phase labor contractions are often described as strong menstrual cramps that become more painful over time. They can also be described as lower abdominal pressure or stomach upset. A good way to tell if early labor has started is to count and time your contractions. When your contraction starts, write down what time it started and what time it ended. This is how long the contraction lasts. Make sure to keep counting without stopping until the next contraction starts and write this time down. This represents the length of time between contractions. Then start the timing again. Early phase labor contractions should begin to develop a pattern. Over time, as the intensity builds, you will notice the contractions get closer and closer together. Contractions during early phase labor last about 30 to 45 seconds. Initially, they may be as far apart as 20 minutes, but will become closer and closer together as you near active labor. Active phase labor contractions are more regular than early phase labor contractions. These contractions will last 30 to 60 seconds and sometimes even up to 90 seconds. Contractions happen at consistent intervals, usually every 3 to 4 minutes. A good rule to determine if this is active labor is the 5-1-1 rule. This is when your contractions are 5 minutes apart, lasting for about 1 minute per contraction, and this pattern has been happening for at least 1 hour. Some practitioners will also use the 3-1-1 rule, a different variation, but the same idea as the 5-1-1 rule, except that contractions are 3 minutes apart. Other signs of active labor may include contractions that a woman cannot talk through, intense focus during contractions, deeper breathing during contractions, and contractions that are more painful and intense, causing some women to request pain medication. Active labor is also usually considered to have started when the cervix has been dilated over 6 centimeters. This is a good time to head to the hospital if you're not already there. This is the final phase of stage 1 labor and is often the most difficult. Contractions are very strong during this phase in order to facilitate the birth of your baby. They usually last 60 to 90 seconds and can occur every 2 to 3 minutes or even more frequently. Transition labor signs include feeling overwhelmed, feeling exhausted, feeling that there is no break between the contractions, even if there is one, high intensity contractions, and wanting pain medication to manage the pain. Transition phase labor is 7 centimeters to 10 centimeters dilation and is usually the shortest in length of time, lasting 15 minutes to 1 hour. The urge to push is often a good sign that you have reached stage 2 or the pushing stage of labor. At this time, you are 10 centimeters dilated. Many women will report feeling pressure in their bottom, feeling the urge to have a bowel movement, and having the urge to bear down. The pushing stage feels different for every woman, and the length is different for everyone. Some women describe pushing as the most pain they've ever felt. Others describe it as a tremendous relief, and some say it's both. As the baby's head gets lower, it stretches the skin of the perineum and the vagina, creating a burning or stinging sensation. This is sometimes referred to as the ring of fire. It usually lasts just a few minutes, as this means birth is imminent. Contractions during this stage are also 60 to 90 seconds long and may occur anywhere from 2 to 5 minutes apart. True labor contractions signal that it's time to have your baby. I hope this has explained the differences between Braxton Hicks contractions and true labor contractions and helped you know what labor contractions will feel like when they begin. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.